Wisconsin has seen fewer numbers of COVID-19 cases reported over just the last few days.
Now, that could be seen as a good sign, of course, about the future of the pandemic in the state, but doctors are saying don't get too excited yet. A post-Thanksgiving surge could change the direction of the virus in Wisconsin. UW Health's Dr. Jeff Potoff joins us now to talk about the state of COVID in our area and across the state. Dr. Potoff, good to see you.
Good to be here.
We're always very grateful for your time. You know, any downward trend in cases, of course, is encouraging, but the effect of Thanksgiving gatherings is still unknown. So what do you expect to see and when?
We're a little bit worried about Thanksgiving. We know that Sunday was one of the busiest travel days since the start of the pandemic, which would make us think that maybe people didn't stay home in their immediate family groups for Thanksgiving. If that's the case, we'll start seeing positive COVID cases later this week that correspond with those family gatherings. And then shortly after that, we may see an increase in hospitalizations, which is the last thing we need right now. Our hospitals are already busting at the seams.
Yeah, I mean, that's the big concern. You know, the hospital beds are full, and you hope that, you know, we can just kind of bridge this gap before the vaccines come, right?
Right. You know, even though case numbers were down, our census at UW Hospital hasn't really gone down. In fact, we broke a record again today for total number of COVID cases. And the vaccines are great. It's a light at the end of the tunnel. But, you know, there's a long distance to go before we get there. We can't throw up our hands in celebration yet. We got a little bit more game to play before we get to the vaccine.
We also broke, unfortunately, another single-day record in the number of deaths in Wisconsin, COVID-related deaths at 107. And it's December now, thank goodness, but in November, the U.S. reported more COVID cases than most countries have reported all year. So what's your sense of why that is? What's going on?
You know, when we look at countries that have done, you know, frankly, better than us in managing their COVID pandemic, you know, one of the things they have in common is a national strategy. Guidance from top leaders about what to do, when to do it, and then support to help those businesses and those people when they have to take action that disadvantages them. And, you know, we haven't really had that approach in the United States. We're a little bit more independent. I think we value our freedom, and we took a more, kind of figure out what you want to do for yourself approach. And I think we found that that just wasn't an effective way to battle a pandemic.
Dr. Potoff, this might sound crazy to open the windows in December, but we get to December, it's the first day of December, the temperature's going down, and we all get trapped inside our houses. Should we encourage people to get outside if at all possible, get fresh air, do whatever they can? Because that trapping inside seems to be a contributor.
Yeah, I think, two points. One, just from the mental health standpoint, it's not like you have to lock yourself in your house and be in jail or risk getting COVID-19. There's things that we can do. We can go outside. We can socially distance, even more than 6 feet and see people that we like. One thing we can't do is start to gather indoors. You can't have friends over. You can't have a large group of people over to your house, or we're going to see spread of the virus. It's still present. It's everywhere right now in Wisconsin. Even these somewhat small gatherings, 10 people, we're going to see more cases of COVID. It's just not something we can safely do right now.
Dr. Jeff Potoff joining us from UW. Just real quick, as we wrap up, how are your staff, your fellow nurses, how are they holding up mentally? I know they're really stressed right now.
They are really stressed, and this is hard on them. They are taking care of people who are not with their family. They're trying to arrange Zooms for kind of those final moments in people's lives. That's hard for any human being to endure. Despite that, they show up for work. They sign up for extra shifts. They are truly remarkable people. They realize they're part of something much bigger than themselves, and they're just doing incredible work right now.
Yeah, they really are. Our thoughts are with them and their families this holiday season. So I know they make a lot of sacrifices, and hopefully those vaccines get to them quickly and make a difference. Thanks, as always, for your time, Dr. Potoff, and continued good luck in the fight against this.
Thank you, Dr. Potoff. We really appreciate your time. We'll see you again soon.